So I'm going to kick this off. I know it's Sunday. I don't know if you're worshiping today. Churches are still closed in most parts of the world. So welcome everybody to the News with Obi. My name is Obi Nwaogbe, and the platform here is called the News with Obi, where I talk about everything politics, everything in terms of current affairs happening around the world and in our immediate community. And as you already know, a lot of talk has been revolving around the coronavirus, and rightfully so. Although a lot of the lockdown in most parts of the world are beginning to be lifted, it does not mean the pandemic is over. So I did an interview with a doctor in Nigeria, and it only makes sense if I also interview our neighbors to the west, which is Ghana. I want to find out how Ghana has been keeping its frontline workers safe. And Ghana has been doing a great job. Ghana is one of the African nations that's been doing a great job with the coronavirus. So I have with me here Cindy Ofori-Appiah, and I'm going to read a little bit of her bio. Cindy is a public health nurse. She specializes in infertility, and also she's also an advocate for maternal and child health. And as a team member of the Nursing and Midwifery Services Directorate and Ministry of Health in Ghana, it is no surprise that she also started her own foundation, which is the polycystic ovarian syndrome in Ghana. So Cindy, tell us a little bit about yourself, how long you've been doing this. You have a robust resume. Talk to us a little bit about how you got started, and a little bit about your role in everything that you've been doing with advocating for the coronavirus.
Oh, okay. For quite some time now, I've had interest in women and children, more specifically with infertility. Being a health person, I know my fellow colleagues in the noble profession also face infertility issues. So I thought it wise to delve more into infertility and maternal and child health when I was doing my master's program. And coming out of that, I realized it's a big challenge for most women in Ghana and in Africa when we are going through infertility issue because of its stigma here and there. People don't come out. So I decided to come out more to advocate for women who are going through such issues. I do more of awareness on health issues on maternal and child health. But with COVID, which was a surprise to every other country, not Africa and Ghana alone, I took it upon myself again as being an advocate for maternal and child health to speak to the people of Ghana, especially with the precautionary measures. Because no matter what happens, women and children are vulnerable when it comes to this issue. And during this pandemic, we have our pregnant women still going for antenatal care. Labor is still coming on. We still need to do our child welfare clinics. So we needed to come out more and create the awareness to keep our flats down so that at the end of the day, that the vulnerable in the society, that's women and children, who wouldn't find ourselves wanted.
So I know, like I mentioned earlier, Ghana has been doing a great job to help to flatten the coronavirus curve. I don't know about Ghana, but I know in Nigeria, they set up what they call isolation and containment centers. Is that the same in Ghana? How have you guys been handling people that have been in contact or currently have the virus?
Yes, we also have the containment centers here. And then we do our best. It used to be just two. That was January when we heard of COVID-19 at China in December. Ghana prepared itself along the time. In around January, we used to have only two centers. That is within the EPIC centers, Greater Accra region and Tema. But as we speak now, we are having more than 56 centers scaled around the whole country. So it's kind of something that we are doing, and the contact tracing out of that also helps us to get the kind of patients or clients who has been exposed to the COVID positive client, so that we can contact them and then trace them and do the treating. So I will say in Ghana, the containment center is there. It's very effective. And then most importantly is with the 3 T's. That's the tracing, the treating, and then we get in contact. That one is excellent that we are doing in Ghana here. And I think it's the best thing that has helped us to get our figures where we are now.
So as of a few days ago, the number of coronavirus cases in Ghana, according to the CDC, was a little over 4,000 and about 22 deaths and over 300 recoveries. Are these numbers accurate? Would you say those numbers are up to date?
The numbers are accurate to the best of my knowledge, because these numbers are coming from the Ministry of Health of Ghana and Ghana Health Service. They come up together with these figures to come out. So to the best of my knowledge, this is the best results or the best figures coming out. It's not like we are underreporting the figures. They are the right figures coming out.
Right. Okay. That's awesome, because some parts of the world that are remote, that nobody can really get to at this time, those figures are not really put into consideration or are not added to the final number. So that's awesome. And I know also in Ghana, drones have been used to deliver COVID-19 tests to remote areas. Talk to us a little bit about that.
Yes, with the drone, we have had to reach areas in Ghana, and the best way we can use is to go through with the drone services. COVID-19, we are not targeting only the rural areas, the urban areas, sorry. The rural areas are also part, and some areas or our borders are porous. So we try as much as possible to get to those areas, and then take samples and bring it down to the assigned labs that are working on the COVID samples. So the drone is very effective.
Okay, that's awesome. Looks like you really Ghana really has everything under control. So I do see on Instagram we have some people joining us. I know I have some of my Ghanaian friends online. If you guys have any questions for Cindy, please feel free to type it in so she can address those questions. And also, Cindy, since this whole coronavirus thing is revolving around social distancing, constant hand washing, in some rural areas, something like that is impossible. The same can be said for us here in the US, that, people that live in clusters, they might not be able to social distance much. So, and I've also seen some videos of some ingenuity that Ghanaians have been creating, like little hand washing locations and bowls being placed in different areas. So that's awesome. And those things I've seen are like solar powered. So that's amazing. So talk to us about, as an advocate for public health, talk to us about how Ghana has been going to make sure that people in the rural areas understand why social distancing is important.
Yeah, social distancing is very important now. I would say Ghanaian, even a child of under 6 or 5, they now understand hand washing and using of hand sanitizer now. I like comparing for your viewers to really understand, as Ghanaians, as Ghana, where we are now. People didn't get what hand washing was all about, even though we do hand washing in our various ways. But now with COVID, every other person, as I said, under 6, really understand what is all about hand washing. And they're really doing well with hand washing. But social distancing is our challenge now.
Yeah.
And
That's
enforcement is being done.
African countries, with our culture, social distancing is not a thing. So, so it's really tough to really incorporate that.
Yes, it's quite difficult for the populace or the society to really adhere to social distancing compared to the hand washing and using of hand sanitizer. But rules and I would say measures have still been put in place, and education is still going in different languages down to the grassroots for those at the rural areas to really understand. Even in the urban areas, we really have a bit of challenge. And that one we are doing as much as possible that we can also to bring it down. There is more innovation when such pandemic issues come out, and most Ghanaians are doing well with innovation, like as you just said, with the hand washing techniques and stuff. Currently, a gentleman from Kumasi, one of the regions in Ghana, that's the Kwame Nkrumah University, Science and Technology. He came out with a very new design that it can be put on the entrance of any organization, on any home, that when you are entering, the chlorine spray on your body before you can enter into the premises of wherever that you are going.
That's really nice.
Yeah. So and I can see this thing has brought more innovation out from the populace or from the youth and the Ghanaians, and it is helping, and the government has taken notice of that. So I would say hand washing is going on well. Technology is coming. Social distancing, we are still working on it. Measures are being put in place. Our market areas are not well designed in terms of Africa. Our set
Right.
of market areas are quite different.
Right.
Most of the stalls and stuff are different, but measures have been put in place by the municipal assemblies and the district assemblies, and in that local level, for the opinion leaders in that areas to come out to support, so that they can help with demarcations, and then everybody can be comfortable. But I can say gradually we are there.
That's amazing. And one of my good friends, Ofori of Studio Maxi, she's from Ghana. She's actually my stylist. She's the one that dresses me. She asked a question on Instagram. She said, "How do you educate the people who don't have TV or cable and how to protect themselves?" And I believe you've addressed that. From earlier, you're saying that the different languages and going to the local leaders as well. Is that right?
Yes. And then we have vans. We have information vans going around in such areas that they don't have access to television or internet, that we do the announcement. We have a system in most of our rural areas, our rural folks, that they have a way of announcing, beating the gong, announcing.
Right.
We have people being elected in the community who do
Exactly.
such kind of announcement when there is a funeral or there's going to be a gathering. Yes, and when there is any government officials coming from the capital city to them, we have people there who do that kind of announcement. So we work in line with them, and they do the announcement with us as we are going about in their van, in their villages, just talking and just making the announcement for people to understand us. So with the rural areas, we've touched them.
That's awesome, because even when I have a background in strategic communications, the first thing they teach you is, if you want to get the trust of the locals, you really have to go from the local leaders, and they can help you with that. Because if the people don't understand why you're telling them, oh, you got to be 6 feet apart, or you have to wash your hands more frequently now than you've ever before, it's going to be hard. So it starts from the local leaders, and like you said, like the town crier goes around and trying to disseminate the information. So that's really awesome. So where do you see Ghana in the near future with the virus? In your educated opinion, do you foresee it getting better or worse?
With the kind of attitude we are putting up, I would say, Obi, Ghana, we are really doing our best in terms of education. As I said earlier, with both languages on every social media, is all about COVID here and there.
Yeah.
People are understanding, others are putting up different kinds of attitude. So personally, if we put such attitudinal behaviors, negative attitudinal behaviors aside, and follow the precautionary measures, I will say Ghana will be flattening the curve very soon. Even what we are doing now with you, Obi, is a form of another education, for people to really understand, so that that kind of attitude which is blocking or which is impeding we getting our figures or the curve down, they will change. If we all adhere to the precautionary measures, I believe our curve will get down, it will be flat, and then I will say confidently that Ghana in future, I think will be okay, and then COVID curve will be down.
That's amazing to know, because like you said, there's still some people saying COVID-19 is not real, it doesn't exist, and all that kind of stuff. So like you said, the positive attitude is what's really gonna make a difference. So in terms of protecting the frontline workers like yourself, have you guys been having enough equipment, enough gear, enough gloves, enough masks? Has that been a problem?
With COVID, as I said, COVID came as a surprise to most countries, you know. No, I would not say personally that every other country was prepared to receive COVID. COVID came unexpected. And then I would say, to my best of knowledge, Ghana, we are doing our best like every other country is doing when it comes in terms of PPE, and then the frontline worker and stuff. You know, we are really doing well with that now. We are not sitting to wait down for what do you call it, the donors to bring PPEs down for us. We are manufacturing our own PPEs down here in Ghana, so that we don't waste time to delay to supply to our health workers to help them or enable them to be effective on the field. So I would say the PPE is being given, you know. Every facility in terms of where, especially where we have the isolation or the containment areas, the PPEs are being given. We have the district level, they're also getting their PPEs. But one funny thing is the PPEs are mostly disposable, you know.
As they should be.
As we keep using, with discarded. And now the beautiful thing I love about the people of Ghana is they really understand what is called giving. So as much as the government of Ghana is doing his bit to support, to ease the health workers, to make our work comfortable, we still cry for more, you know. So the philanthropists in Ghana, the corporate bodies in Ghana, churches in Ghana, some are really helping. They are donating so much to facilities to help us to work. And I will say kudos to all of them, you know, is making our work easy. I know some corporate bodies who are even donating to security agencies, the media houses, so that they can come to the containment centers well dressed and then do a video and show it to the public to make them know this is real, the battle is real, we are really fighting something, so they should adhere to measures.
And thank you if you're just joining us. I am here with Cindy Ofori-Appiah. She is a Ghanaian-based public health nurse, and she's talking to us about ways the Ghanaian government and the Ghanaian people have been working to curb the coronavirus, and how Ghana has been keeping its frontline workers safe during this time. And if you have any questions before we leave, just feel free to type it in. And Cindy, I also wanted to ask you in terms of how our viewers can support you after this. You know, do you have like a practice? I don't know if that's a thing for your field, but you know, anywhere we can find you, because I know I follow you on Facebook too. You are one busy, popular woman. Like, you're really out there. You're really advocating for the people, and that's amazing. So how can our viewers find you? How can we support your work?
Viewers can find me through Facebook. I think that is the commonest area now. And my name there is Cindy Ofori-Appiah. So viewers can find me, or even on Instagram. The name is IAM_Cindy_Ofori_Appiah. So people can
You're not that active on
Instagram, and they can contact me through YouTube. Yeah, they can contact me through OB, you know, and I know OB will get to me. And anybody who wants to help Ghana as well, if you contact me, we'll get to the authorities, and then every donation you want to make, I think the authorities will get it, and then Ghana will be proud and be grateful to you.
Thank you. Thank you so much, Cindy, for hopping on this afternoon. I know you've still been working. And one more question, has the lockdown been lifted in Ghana yet?
Yes, the lockdown has been lifted, but our borders are still underlocked.
Okay.
Both the port and everywhere, the airports, our neighboring borders, they are underlocked for now. It's been extended for 3 weeks. So end of this month, we are expecting the government of Ghana to come back and then speak to us.
Okay, thank you. Thank you so much. And thank you everybody for tuning in. Cindy did a great job. If you're just joining us, I am gonna post this later on YouTube, and Instagram Live is gonna live online for the next 24 hours, not unless if I move it around, it can live there a little longer. But Cindy has been really informative, and like she said, if you need to contact her or donate to Ghana just to help with the efforts that they're doing, you can reach out through me, or you can reach out through her Facebook page, which is Cindy Ofori-Appiah, and also here on Instagram as well. So thank you so much, Cindy, for taking the time out. Thank you everybody for joining. There's no News with Obi without you guys, so thank you for tuning in and also asking these questions. I'm gonna do my best to keep bringing on people to talk to us about this. Even when it's done, there's still a lot to talk about. So thank you once again, and thank you, Cindy. Have a great Sunday afternoon, everybody.
Thank you. Thank you for having me.